If you're turning 65 soon, already on Medicare, or helping a parent or spouse figure this out, you probably know by now Medicare can feel like a maze. So today we're going to cut through all the noise and focus on the one plan that I recommend more than any other, which is Medicare Supplement Plan G. By the end of this video, you'll know exactly what Plan G covers and what it doesn't, why it's so important in all 50 states, what makes it different from Medicare Advantage, how your premiums are actually set, and the biggest mistakes people make when they enroll into Medicare Supplement Plan G. So let's dig in. When you join Medicare, you get Medicare Part A and Part B. Part A covers hospital care, so inpatient stays, skilled nursing facility after a hospital stay, and hospice care. And Part B covers outpatient medical care, so doctor visits, specialists, surgeries, lab work, you get the point. But here's the catch. Original Medicare, Part A and Part B, only pays 80% of your approved costs. That leftover 20% is your responsibility, and there's no out-of-pocket maximum on that 20%. So if you have a big surgery or a chronic condition, that 20% can become a huge burden. That's why people get a Medigap or a Medicare supplement plan to protect their savings and remove the fear of unpredictable medical bills. So what does Plan G really do for you? Plan G is like a safety net for your healthcare budget. It fills in the big gaps original Medicare Part A and Part B leaves behind. So you pay very little out-of-pocket costs except your small Part B deductible, which this year in 2025 is $257. So if you had a Plan G, you don't worry about surprise hospital bills, you don't get hit with a $10,000 surgery bill, and you definitely don't have to stress about a rehab stay wiping out your entire savings. Once you pay that small $257 deductible, Plan G picks up the rest of all the approved Medicare costs. So let's say, for example, you need a knee replacement. Medicare approves it, Medicare pays 80%, you pay your Part B deductible, the $257 if you haven't already, then Plan G covers that leftover 20% entirely. And that 20% could easily be $3,000, $5,000, even more, all paid by your Medicare Supplement Plan G. Now let me give you a real story. A couple I worked with last year, a husband and wife in Texas, both got on Plan G at age 65. A few months later, he had a heart issue that led him to a hospital stay, multiple cardiologist visits, and a procedure done. The total Medicare approved amount was over $60,000. But with just original Medicare, they would have owed more than $12,000 out of their own pocket. But because we signed them up for the Plan G, all they paid was the Part B deductible, the $257, and that was it. No coinsurance, no copays, and definitely no headaches. They also didn't have to get any type of referrals. They didn't have to check networks or fight any bills. They just focused on getting healthy. And that peace of mind is what people love about Medicare Supplement Plan G. One thing people really love about Medicare Supplement plans is they're federally standardized, meaning that Plan G benefits are identical everywhere you live. So whether you live in California, where most of the costs are typically higher, or Florida, where most people go to retire, or even Missouri, my home state, no matter where you live, Plan G's coverage is the exact same. Hospital coinsurance, skilled nursing, foreign travel, Part B coinsurance, they're all covered. However, what does change depending on where you live is two things. One, the monthly premium can change drastically depending on where you live in the United States. And the second thing that could change depending on where you live is whether you might qualify for a special switching rule in your state. That's why it's so important to compare companies and understand your state's unique rules so you don't get stuck paying more than you should. A lot of people get confused because they think, is Blue Cross Blue Shield better than Aetna? Is Mutual of Omaha better than Cigna? The truth is the Plan G coverage is identical with every single company. The only difference is the monthly premium that you pay every single month. Number two, how much that premium might increase each year. And number three, the customer service of the company. So a big part of my job is helping you compare apples to apples so you don't pay more for the exact same plan with another carrier. So how much does Plan G actually cost? Plan G premiums vary a lot. A healthy 65-year-old non-smoker might see a premium of $90 to $130 a month in some Midwest states, while another person, same healthcare coverage, is going to pay $140 to $180 a month in some higher cost states. Now, some states do have what they call community rating, so your rate doesn't go up with age, but the starting premium is often higher. And obviously, the older you are when you sign up, the higher your rate could be. And yes, your rate can increase over time. That's why comparing companies and looking at their rate history is a very good thing to do. Now let's pause here because I get asked this a lot. Why would I pay $100 or $150 a month for a Plan G when I can get a $0 a month plan that's a Medicare Advantage plan? And it's a fair question, but here are the differences. With Medicare Advantage, number one, you're usually in a network. Whether it's an HMO or a PPO, you have to stay within a certain network to be covered. Number two, you often need referrals to see specialists on Medicare Advantage plans. With a Medicare Supplement Plan G, you will never need a referral to go and see a specialist. Number three, with Medicare Advantage plans, you'll usually pay a copay for doctor visits, hospital stays, and surgeries. With Medicare Supplement Plan G, you'll only pay your $257 deductible, and then you have 100% coverage no matter what. And number four, Medicare Advantage plans, you have an annual maximum out of pocket, which can be over $8,000 a year that you could be responsible for if something happens to you. So yes, you may pay less upfront with a Medicare Advantage plan, but if you get sick, your costs could add up very quickly. With Plan Gs, you have no network, you can see any doctor, you'll never need a referral, you'll never have a big surprised bill, and you're just gonna pay your Part B deductible if anything happens to you. So a lot of people are willing to pay a bit more each month for the peace of mind and freedom knowing that they can choose their own doctors and hospitals. Now let's talk about some mistakes because this is important. There's 4 mistakes that I see people make time and time again when it comes to Medicare supplements. The first mistake is missing your Medigap open enrollment period. If you wait too long, you might have to answer health questions later, and you can be turned down when you apply for a Medicare Supplement Plan G. But as long as you do it in your Medigap open enrollment period, you will never have to answer any health questions. It's going to be a guaranteed issue. Mistake number 2 is picking a plan just because it's the cheapest right now. Some companies raise their rates more than others, and the cheapest one now could cost you a lot more in the future, especially if you don't look at the average rate increases over time with the carriers that you're considering. And the third mistake I see is not comparing all the carriers in your zip code. I see a lot of folks at the time paying $30, $40, or even $50 more each month for the exact same Plan G just because they didn't look at all the carriers that were offered in their specific area. And number 4, I see people make this mistake a lot, and it's not reviewing your plan every single year. Rates change every single year, but you can switch, but you need to know your state's rules. So a lot of people get stuck in a plan and they really could get out, but they don't know the rules in their specific area and think that they're stuck. So they never go onto a plan that's more affordable. And that's exactly what I do. I help folks find the best Plan G for their situation. I compare all of their options and I explain their state's rules and avoid them costly Medicare mistakes. And I make sure you understand what you're getting so you can stop worrying about mailers, commercials, and confusing sales pitches. And here's the best part. My help is completely free to you. You will never pay me a fee because the insurance companies pay me if you decide to enroll through me. So you get all this advice and help at no cost to you. So if you want someone in your corner to make this simple, stress-free, and done right the first time, call me. The number's on the screen at 417-742-8828, and you'll personally talk to me, and I'll help you step by step through the whole Medicare process with no fees, no pressure, just real honest help, the same way I'd help my own parents. So don't wait, especially if you're turning 65 soon. Timing matters with Medicare enrollment. Now again, the number is 417-742-8828. 8828. Thank you so much for watching. If you got value from this, please give this video a thumbs up, subscribe for more Medicare help, and share it with someone you love who needs to hear it. I'm Tim Smith, and I'll see you in the next video.